Sure. Well, professionally, I've been interested in aging in Africa because in the future, the majority of the elderly people in the world will actually live in low and middle income countries. So about 80% of the world's elderly population will live in regions like Africa and other low-middle income nations. Mm-hmm. And Africa is aging at twice the rate of higher income nations, and so it's important to understand aging in an African context. And if we think about the health resources available to take care of older people in Africa, there's really not enough healthcare services available to be ready for that change in the population. And of course, my personal connection to this is I was born in Oranje, so I'm very excited to be able to include Africa and Namibia in particular in our study.
Mm-hmm. Just in terms of health systems, like you highlighted, Doctor, perhaps as per your research, just talk to us about how prevalent in terms of mental health challenges like depression or cognitive decline among aging Africans.
Yes, these are very important conditions. It depends on the setting where the person lives. So if we think about the general population living in community settings, if I go to a healthy person's door-to-door, the prevalence of those conditions will be below 10%. But if I look at people that are getting community health services or maybe having a greater difficulty, we see rates of cognitive impairment in the range of 15%. When it comes to mood disturbance, though, so depressive symptoms, across the 14 African countries we've already studied, we see much higher rates of depressive symptoms ranging from around 16% as a low to over 50% in some countries. So depression is in particularly a very important problem for older persons.
I mean, Doctor, we know that Africa faces unique challenges, and Namibia is no exception. With Africa's older population set to triple by 2050, what gaps, in terms of geriatric care did this project expose, especially when it comes to poverty and HIV survivors and other, non-communicable diseases? I mean, given that you also highlighted that, it's more prominent in terms of, the low income.
Right, yeah. The biggest gap is a health human resources gap. So you do have good mechanisms for primary care and using community health workers to provide supports in primary care services. But there's two challenges. One is expertise in geriatric medicine. There's not enough training programs in most African nations in teaching doctors and nurses and rehabilitation professionals in geriatric medicine. So the teaching component of that is very important. But the other piece that's really missing is assessment methodologies. So with many conditions of aging, you can't do an X-ray and see what the problem is. You have to actually do an assessment where you ask the person questions about their mood, their level of pain, their ability to carry out day-to-day functions. Mm-hmm. And for that, you need to observe or ask the person questions. And my research team has developed an assessment method that community health workers can use to do a comprehensive geriatric assessment for older persons at a very low cost. And what we found across the 14 African studies that we've already included in the research is that the quality of those assessments is comparable to assessments done by a regulated health professional in high-income nations. So there's great potential to use this to address a major gap in services for older Africans.
So, just given that, how do we then strengthen perhaps self-report tools, especially without advanced training, like you highlighted, Doctor?
Yeah, the key thing is that we have done a great deal of scientific research to create a self-reported tool that people can answer for themselves or with the help of a family member. And all they have to do is to be able to answer the questions. It's like a survey. And so a community health worker who doesn't have to be a highly trained nurse or doctor can ask the questions, it can record it, and then with a computerized program for it, it can be analyzed and summarized, and that information then can be shared with a primary care doctor or nurse to interpret it and help to identify older people at greatest need. So it's a very efficient way to get high-quality comprehensive assessment information to doctors and nurses without a lot of cost.
Mm-hmm. Just in addition to that, Doctor, perhaps just talk to us about how African policymakers, or even including Namibia, of course, and communities implement these tools moving forward. And what's next for the project?
We are working with colleagues at the University of Namibia to include Namibia in the pilot project. So that part of the study is fairly simple. We are now writing up the scientific results for all the African countries. And so our next stage of research is to move from just testing this out to actually now starting to use it in a few clinics to demonstrate how it can be used on a real-time basis. So that will involve a need for low-cost software solutions and some training for the clinicians for interpreting the results. And we also have to have methodologies to follow people up over time so we can see if their health is improving with interventions that are there. So we have a program of research that we're planning to scale this up, first on a local basis, then on a national basis. And once it does get scaled up, then government officials can use the data from the point of care assessments to do policy planning and to identify regional needs and to allocate services in a way that's based on needs of populations.